Okay, next we're going to talk about how to evaluate and what special tests you want to include for head injuries, i.e. a concussion. All right? So first and foremost, if you think about the concussion, the first thing you're going to do when you have a patient is inquire about their symptoms. If you're out in the field, you may not have a symptom checklist available to you, so what you should do is keep in mind about 5 to 7 symptoms that you want to ask the patient. Okay? So you want to ask them things like, do you have a headache? Do you feel nauseous? Do you feel like you're going to throw up? Do you feel like you lost memory? Do you feel like you don't have a sense of where you are? Okay? In addition to that, you can ask other symptom type questions that we talked about in class. But after you inquire about symptoms, the next thing you want to do is establish retrograde or anterograde amnesia. And this is looking at their memory function. So to establish retrograde amnesia, you want to ask questions that happen before the event. Okay? So if you're at a game or a practice, all right, you might want to ask time of day type question to establish retrograde amnesia. A retrograde amnesia question would be, what time did you report down here today? Okay? If you know that practice started at 3 and now it's 5 o'clock, that's a good establishment of retrograde amnesia if they can answer it appropriately or not. You want to ask questions, of course, that you know the answer to. All right? So don't ask them what they ate if you're not with them to eat their food. Anterograde amnesia would be, you want to ask them questions for events that happen after the injury. Okay? So they just sustained a head injury, so you might want to ask them who was the first person they saw when they came to, or who helped them off the field. All right? So it's important for you to establish retrograde and anterograde amnesia with your patient. Next, as you move on to the objective portion of your head injury evaluation, you want to also, in terms of observations, note any specific emotional or facial expressions that the patient has. We know our athletes much better than most. So we know when they're exhibiting significant or different abnormal emotional responses. As we talked about in the lecture, sometimes as a result of a head injury, a patient may be more combative than they normally are. Okay? And you'll know that because you know the person. The other thing is you want to note for their facial expressions. So you want to note if they look pretty just depressed or not really with it with regard to their facial expressions. Okay? And you're just taking note of that. Next, you need to rule out skull fracture, so you always want to look for that battle sign that we talked about, which would be bruising behind the ears. Okay? Also, you want to rule out a cervical spine injury, right? So we want to rule out any significant cervical spine injury. So even as you're asking them questions, you want to make sure, even if they've walked over to you, okay, just make sure, just quickly palpate their cervical spine and ask them if there's any tenderness. If there is, you should suspect a cervical spinal injury, and you may even have to lay the person down and talk about spine boarding them, even if they've walked off the field. Finally, if they've cleared all of that, we're going to get into our special test for a concussion eval. So in general, there are several things you're going to do. You're going to do a memory test, a concentration test, pupils, eye tracking, reflexes and coordination, and then balance. So let's break each of them down. Okay? Always start and end with a memory test. And if you think about these tests that we're going to go through, they're very similar to everything you do on your SAC evaluation, your standardized assessment of concussion. For those of us that deal with contact sports, these tests will become like second nature to you. So first, a memory test. So for a memory test, you want to give the patient 3 words to remember. Each of them should be 2 syllables. You'll have the patient repeat the words back to you at least 3 times, and then you're going to ask them those words at the end of your exam. So let's go through this. Okay, I'm going to give you 3 words. Purple, table, balloon.
Okay.
Can you repeat them?
Purple, table, balloon.
Good. Repeat them again.
Purple, table, balloon.
Repeat them again.
Purple, table, balloon.
Okay. I'm going to do 5 times. Again.
Purple, table, balloon.
And last time.
Purple, table, balloon.
Okay. Remember those words because I'm going to come back and ask you them at the end.
Okay.
Next test is a concentration test. For a concentration test, you're getting at the area of the brain trying to tax that area of concentration. Okay, so what we're going to do is we're going to do the months of the year in reverse order. So we're going to start with August and we're going to go backwards. So August, July.
Okay. August, July, June, May, April, March, February, January, December, November, October, September.
Very good. Another way to do a concentration test is counting backwards from 100 by 7s or 3s. So you would start, I want you to count backwards. It does not matter how long it takes. I want you to think about it because it's a concentration. So 100, 93, 86, 79, etc. till they get to around 60. So 2 ways to do a concentration test. Next is pupils. So with a pen light, we're just going to make sure that her pupils constrict when the light is shined in and then dilate when the light is taken away. Constrict, then dilate. Constrict, then dilate. Next is eye tracking. Okay, again, if you think about this, we're doing a lot of the cranial nerves when we're doing this assessment. So we're going to do like a star pattern. Okay, so we're going to go. Okay, so we've gone diagonal, side to side, and up and down. Next is reflexes and coordination. 2 ways to do this. First is a finger to nose reflex. So can you swing around this way? I'm going to have you put your finger on your nose. Okay. You're then going to take your finger to my finger and then back to your nose. Ready? Go ahead. Good. The other, for lower extremity reflex and coordination, you can have them do a tandem walk. So stand up for me. And you're just going to walk like you're walking on a white line, heel toe. Good. Okay, come back here. And then the last test you're going to do is a balance test or a Romberg test. So to perform a Romberg test, they're going to be facing you, arms at their sides, okay? Head, straight head, and then we're going to ask them to tilt their head back and close their eyes. A positive Romberg is any increase in sway when they tilt their head back and close their eyes. Okay, good. Sit back down. And you're going to come back and ask the patient if they remember those 3 words. So do you remember those 3 words?
Yes.
Go ahead.
Purple table balloon.
Very good. Okay, so again, to recap, for a head injury, the special tests you're always going to perform are a memory test, a concentration test, assess pupils, eye tracking, some type of coordination test, finger to nose, and then a balance test.